Hello, I come from the future where we do exams online. Hello and welcome back to my channel. I'm Dr. Melanie Denton-Dombrowski with Salisbury Eye Care and Eyewear. We're launching this video in a very different time in our nation and our state, and many things have changed about the way we practice. And so I wanted to address one of the biggest changes to practice that we've had happen so far, which is the integration of telemedicine into what we do every day. So to kind of like back up and give you some background, I'm an optometrist. I do routine eye care, I do emergency and urgent eye care visits, I fit contact lenses and do glasses and all of that. But very recently, the CDC, with everything happening with COVID, has put out that all dentists and optometrists and ophthalmologists and even providers in general. So what we're doing is we're avoiding doing any kind of routine care. So elective surgeries have been canceled in the United States. I know a lot of dermatologists and things are out of work. And in response to all of this, Congress very quickly passed basically legislation that would allow for loosening up the rules around virtual visits and telehealth type appointments. So typically we do office visits, we bill medical insurance as optometrists, and we bill vision plans like as a routine eye care provider. But on that medical side, everything I do is typically in an office visit right here in my office. So it's a one-on-one consultation with you and my team. I look at your eyes in person. I mean, this is the way we know healthcare to be up until this point. With attempting to have our population social distance, stay away from each other in an effort to flatten the curve and reduce the spread of COVID-19, that's made it so we can't do routine eye care anymore. So at this point, my office is open. We are open for urgent and emergent type of care, and then we've integrated what's called telemedicine. And Congress has allowed us to do so, and insurance carriers have opened up their rules as well. And so now telemedicine is something that we can absolutely offer our patients, and most all insurance carriers at this point are getting involved. So let's get into it a little bit, shall we? All right, so who is a good candidate for a telemedicine type appointment? So my view of this, I'm using it for anterior segment issues, and when I say that, I mean front of the eye issues, red eyes, maybe something in the eye. But truly speaking, if you have anything going on with your eyes, I invite you to call us and see if it's something that we might be able to answer by video chat rather than having you come in the office. The reason is that I'm very good at this point, I like to think anyway, at taking a really thorough history. I come from kind of a long line of optometrists, and I remember very early on in my career, my uncle told me, if you can take a really thorough history, the rest of your exam is just confirmatory. So if you've done a really good job, you almost don't even have to look at the patient. You have it down to maybe one or two things that are going on. And I've always agreed with that, and over the last 10 or 11 years, I've honed my skills in that department, and so I really think that's what I have to offer when it comes to these like virtual appointments, is you can sit down face to face with me. Yes, I can see you and I can see your eye, at least part of it. But a lot of what we're accomplishing there is you're having a trusted source, an experienced practitioner, triage your problem. That way you don't have to go to an ER. We're absolutely helping out the healthcare system by keeping you out of these crowded places, these places where you potentially could expose yourself. And it's just helping the entire healthcare system if eye care providers can take care of your eye issues rather than having to go to like a hospital for something like that. Just to clarify, there are some appointments that I just can't do. We can't do routine at this point over the computer. So this is absolutely not for that, but this is for something urgent or emergent. These are things that I can triage for you. These are red eyes. These are maybe something in your eye, not sure. Just different things like that. So how would you accomplish this? So what I would encourage you to do, and this situation is evolving. I don't know what our hours are going to be next week or the week after, but I can guarantee you this. We check our voicemails. Even if we end up being closed as an office, we are going to check our voicemails. We are going to have open hours where we can schedule you, and I will remain available to you throughout this whole process. So first of all, call our office number, and that's where you'll get the most up-to-date information. Like I said, the situation may evolve and change, but if you see this 2 weeks from now, still call our office, and you'll either get a person or a voicemail explaining the situation at that time and what you should do next in order to reach me. At that point, I'm gonna have one of my members of my team kind of triage you first. My team is trained for that. They've always been trained for that, because even when we were open and seeing patients day to day, they had to be very, very good about triaging and deciding when patients needed to be seen. And so you're gonna talk to one of them first, and if they feel that you need to see me via telehealth, they're gonna schedule you with me. Once you're scheduled, they'll take a look at your insurance and see what your coverage is like and communicate that back to you. And then in order to get onto the website, you simply go to doxy.me/Dr. Denton. We'll put that on the screen so you can see it as well, but that's gonna get you into my waiting room. And then once you're there, I can actually see that you're there waiting for me. And I'll just pop in on a chat with you, and we'll do your exam just like you've always done your exam. It's very, very similar. It's just a little different. It's just you and me talking about your eyes, and we'll figure out what's going on with you and where to go from there. We're gonna run you through, I kind of want to show you what doxy.me looks like. So you're gonna just open up a normal browser window, and you're gonna go to doxy.me/Dr. Denton. When you get there, you're gonna come to a welcome screen, and it's gonna say, "Welcome, please check in below to let Dr. Denton know that you're here." Literally, all you have to do is put your name in. So I'm gonna put Melanie and check in, and then it's gonna ask you to enable the camera, and I would recommend you do that. It makes it a lot easier. And then from here, you're on the screen. And you can see you're in my waiting room, and I'll be able to tell when you're available. If I say, hey, I can't do this virtually, you need to come into the office, that is totally fine. Like I said, we are open for urgent and emergent type of situations, and at that point, we'll get you in, and there's no extra charge. It's just part of an office visit at that point. We'll get into those specifics if you call. I don't want to get into that on the internet. So, at any rate, thank you for listening to this about telehealth. It is a brand new world that we're living in, and if I were a betting woman, I would think that we're gonna see more telehealth here, definitely in the next couple of months, and maybe even ongoing. So I definitely think a lot of things are gonna change, and I'm really excited about the capability to be able to talk to you guys virtually. I think it's so, so awesome. I've already done several of these appointments, and they've just gone very, very well, and I'm able to take care of my patients without having to send them into an emergency room or other care provider where they might come in contact with COVID. There's just no reason to unnecessarily expose yourself. And for a lot of reasons, like you can get, you want to be exposing yourself in parks and stuff. You get arrested for that. Until then, every Wednesday, 4 o'clock, new videos, so make sure to like, subscribe, hit the bell, and all the stuff. And I'll see you next time.